In my office as a urologist, one of the most common things I see is an enlarged prostate in men. It's very typical after the age of 40. And sometimes with an enlarged prostate, we start having symptoms of difficulty urinating or a weak urinary stream or getting up a lot at night to urinate. So that's a natural progression. So as a man, we're exposed to testosterone, which is our man hormone, and it feeds our prostate and it typically allows it to grow. So once you start noticing that you're getting up a lot at night to urinate, or you're having trouble starting the stream, some people have symptoms where they go urinate, they leave the bathroom and turn right back around and go urinate again. A lot of guys typically say this is just old age, and it is kind of true that it is related to your age, but you don't necessarily have to live with those symptoms, and we can make them a lot better. Several years ago, the only treatment was to do a procedure called TURP. And the way that worked is we go in with a camera and we shave the prostate. Had a lot of complications associated with a lot of bleeding, blood transfusions, the need to stay in the hospital for multiple days. We eventually started forming medications. One of the most common one is called Flomax or tamsulosin. It helps to relax the prostate. It opens up the channel and allows you to empty your bladder more adequately. But it has a lot of side effects, like dizziness when you stand, or the inability to ejaculate, and that can be very troublesome for a lot of patients. But now we have other options. So we have these minimally invasive procedures out there. There are many of them. Currently, I do one that is that's been around for over 10 years now and has definitely improved quite a bit. It's called a UroLift, okay? And it typically is the least invasive procedure that can be done on the prostate, allows you to urinate adequately, does not affect your ability to ejaculate, and typically doesn't require a catheter either. It takes about 10 minutes to do, and you go home the same day. It's a great procedure, and I think it's something that I try to encourage my patients to consider, and it certainly has a greater than 90% patient satisfaction rate. For example, if I were to put a camera in through the urethra, which is the P tube that's coming out of the penis, and I would go into the penis down to the level of your prostate. So your prostate sits right here, in between your bladder and your P tube. And as an enlarged prostate grows, it starts to compress this urethra, and this is what it looks like, where the left and the right kind of kiss each other, causing a blockage. And it causes you to have to generate a lot of pressure to get the urine out from this prostate, causing a blockage. The way the UroLift works is I go in with the camera, and I put these clips in the prostate that opens up the tissue this way. You can see how this channel is open compared to this one over here. This is what it looks like at the end of the procedure. I kind of describe them as little thumbnails, kind of pushing the tissue out the way or opening the curtains. You don't actually remove any prostate tissue, which is what allows us to avoid any side effects, like sexual side effects, like retrograde ejaculation, and it typically doesn't require a catheter either. Now, these clips are permanent. They stay in your body forever. They never need to be removed or anything like that, and it's a pretty safe procedure, very low risk. Now, this is a procedure that typically lasts at least 5 years. So since we're not removing any prostate, it's something to keep in mind. Along with that, not every prostate is a good candidate for it. So I can't just sign everyone up for this procedure. So it's a good idea, if you are considering it, come by and see one of us, and we could do some further testing and see if you're a good candidate for it. And we could also consider other procedures that are also available that are minimally invasive for the prostate that might work better for you. So it's a conversation that we have together when we make this decision together. So every urologist kind of does their evaluation a little bit different. The way I like to do it is I do an ultrasound that goes through your belly to take a look at your bladder and your prostate and the size of your prostate. And I also like to do a cystoscopy. So I will go in with the camera and I will show you what your prostate looks like. And you're awake and I show you exactly what it looks like. It's a quick little procedure and it's nice. We learn a lot about what your prostate looks like, the size and shape of it, and I could talk to you a little bit about what to expect if we decide to proceed with the UroLift, or I may say, hey, despite me doing a lot of UroLifts and loving the procedure, my best interest is what's going to work for you. I want you to have a good outcome, and I'll talk to you about other things that we might be able to do. So actually, over the past 6 months, I've done well over 100 of UroLift procedures. In fact, I've recently reached called Center of Excellence, which is an achievement that only 2 urologists in South Florida have, me being the second one. It certainly is a good idea to get procedures done with physicians who've done a lot of them and are experienced with them and know kind of how to tailor the procedure for the patient, because not everything is black and white when we talk about medicine. So certainly I do think that it's a great procedure. I believe in it, and that's why I've invested in it. And I've also followed my patients and seen their outcomes, and I've seen that the guys have gotten great outcomes with it. They're very happy with it, and they're able to return to their normal activities with little to no changes into what any side effects when it comes to sexual side effects or incontinence.